Hello everyone, welcome to Forward Head Posture Cause and Cure. Thank you for joining my seminar. I'm Dr. Paula Moore, a chiropractor, posture doctor, online educator with a fellowship in the physics of posture. And for those of you who don't know me, I'm also the creator of a popular video blog, Posture Videos, with over 9 million views to date. That's pretty crazy. So let's dive straight into today's seminar and really important topic. So forward head posture, and please stay tuned right to the end of our time together so you don't miss out on any of the exercises I'll be demonstrating later in the seminar. So today I'm going to cover the 3 main causes of forward head posture and the unique signs and symptoms that pair with each of those causes. You'll also learn what treatments are needed to correct your forward head posture, and you'll get a realistic answer to the question I hear so often: how long will it take to correct my forward head posture? Then I'll briefly discuss how to prevent the return of poor postures once corrected. We've got a lot to cover.
I want to take a moment to encourage you to stay right to the end of our time together. There is so much value in the next 30 minutes. I'm going to show you the correct way to tuck your chin and how to restore your mid-back flexibility so your forward head can really move back. I'm even going to show you real x-rays of people just like you who had minor car accidents and how those car accidents caused their forward head posture. The x-ray images are pretty dramatic.
So what is forward head posture? You may recognize this Canadian music heartthrob, Mr. Bieber, and his forward head posture. So forward head posture is simply when the head moves forward relative to the shoulders, where it ideally should be located to have a mechanical advantage. So for instance, if I gave you a 10-pound bowling ball, roughly the same weight as your head, and I asked you to carry it around with you all day, where do you think you'd want to carry it? Out in front of your body in a forward position, or tight to your body near your center of gravity? Because you'd get pretty fatigued with it out in front of you, wouldn't you? So what's the big deal with forward head posture? Well, besides the very real effect that it has on our self-esteem and confidence, and let's be honest, there are a lot of us wearing scarves and collars to hide our appearance because a forward head isn't very attractive. Forward head posture is also a problem because it leads to chronic muscle tension. According to the Physiology of Joints, Volume 3, every inch, only 2.5 centimeters, of forward head posture can increase the weight of our head by 10 pounds. So now we're carrying around a 20-pound head. It's no surprise that the muscles at the base of the neck and the top of the back and shoulders are constantly tight, is it? Add this extra weight to the top of the neck, and suddenly that's putting a lot of strain to these facet joints in the neck. Here they are between the bones. See, they add up a little bit like shingles on a roof, and when the head comes forward, they can shear and wear away the joints and also the discs over time. So this is what's known as arthritis in the neck. Also, this forward head posture can reduce our vital lung capacity by up to 30%, says Dr. René Calais. He's the founder of rehabilitation medicine. And lastly, it can cause artery and nerve damage because as the head travels forward, the nerves here in yellow and the artery, the cerebral artery that travels up to the brain, they become tractioned and strained and stretched. So the garden hose analogy. On top, you've got the normal garden hose with gentle curves and normal water flow. Now, if we were to compress the hose, as we compress and stretch the artery with forward head posture, the vertebral artery, it can reduce the flow. In fact, there was a really good article, a study done in the Journal of the American Geriatric Society in 2004. And they said that hyperkyphotic posture, defined by how many blocks were needed under the head of the subject in order for them to lie flat. In other words, the more blocks that were needed, the more forward head posture the subject had. And this round and forward posture was specifically associated with an increased rate of death due to atherosclerosis, which is hardening of the arteries due to damaged blood vessels. Now, hardening of the cerebral artery in the neck, that's the main artery that flows up to the brain, is associated with Alzheimer's disease and stroke. So do we think forward head posture is a really important topic and health concern? Absolutely. There are three main causes of forward head posture that I've put in orange, blue, and yellow. So along the left of the graph here, this is length of time to correct your forward head posture in months, so right over 2 years. Anything above the 24 month mark is 2 years plus. So the first cause of forward head posture is habits of daily living. And for that, I've suggested up to 6 months to correct. Many of you will notice changes within the first few weeks even. The second cause of forward head posture is due to compensation for a posture issue lower down, and that can take up to 12 months to correct. And the final cause of forward head posture is trauma, right from childhood up to whatever age you are now. They tend to be the toughest to correct, and I've marked here they can take up to 2 years or more to correct. Now there's this funny category here that I've marked in gray for spinal anomalies, things we're born with. So they could be malformed vertebra, 2 vertebrae fused together, even fewer or more than the 7 usual numbers of vertebra we find in the neck. So forward head posture that results from anomalies from birth can't be corrected, as this is the only way the body can be positioned due to their irregularity. This can only be diagnosed on X-ray, and they occur in about 12% of the population. And I have found quite a few in private practice over the years. So in order to talk about abnormal postures like forward head posture, we need to understand normal for the neck region. So think of your posture as the position of your body, and that position reflects how you've been living your life and adapted since being a child even. And none of us has perfect posture. I prefer to talk about ideal posture. And for the head and neck, that's ear over top of the shoulder, and the ear's roughly this region here, shoulder down here. 7 wedge-shaped vertebra, no bony spurs. Nice healthy disc spaces between each of the bones, which you can see here. And a nice C-shaped curve, the red curve, and it should ideally be 40 degrees. So the first cause of forward head posture are our habits of daily living. So absolutely our mobile device use, iPads, reading, just reading a regular book on your lap, even incorrect sleeping postures, poor ergonomics and car setup, and then activities of daily living, things like washing dishes, brushing our teeth, using the toilet, and just not thinking about our posture, or perhaps not yet knowing the correct postures and how to maintain them. I'm always doing a bit of posture cam. Here I am at the Toronto airport waiting for a flight. And you can check out the position of this woman's neck here as she's reading. Not a very happy angle, is it? So what are the signs and symptoms you might be experiencing if you have forward head posture due to habits? Here's my best friend sitting on my couch with my dog Milo, and she always sits in this position. Do you think it's any wonder that she'd have a curve in her back or some lower back issues or maybe even some shoulder issues because she's always tilting at the shoulder area? So other symptoms might be stiff neck, tense shoulder, even jaw dysfunction, clicking and pain, mild headaches, and muzzy head. So you kind of feel just muzzy headed, not quite yourself during your workday. These are common symptoms that I hear about. What about treatments for forward head posture caused from habit? Well, manual adjustment. You'll hear me talking about this again and again. That could be from a chiropractor, a physio, an osteopath. And if you think you might need x-rays, then a chiropractor should be your choice, as they have 4 years of radiography training in university. So they can take, measure, and diagnose your posture issues. Obviously, change the bad habits. So for instance, you might want to read with several cushions on your lap. If you've got a desk-based job, then you need to learn about active sitting so that you're fidgeting and wiggling while you sit. And then you want to create new, healthy posture habits. And good posture isn't really about luck and being blessed with good genetics, by the way. It's a habit. Just like riding a bike. When you're a child, you have to keep getting back on the bike until the habit of balance becomes hardwired into your brain. And then you never need to learn how to ride again. Your brain simply remembers. Changing your habits means to have awareness throughout the day. Look at this sleeping posture. This picture is one I found of people sleeping rough on the streets, but this posture is just brilliant. The man's got just a gentle knee bend, lying on his side, which I like. His back is lovely and straight. And in fact, you don't need a pillow at all. He's using his arm, and that's how a lot of people who sleep in more primitive cultures, then they don't have beds, they would sleep in this way. Love that. And then ergonomics at work. So this is my favored position. In a chair, you want your hips slightly above the knees so that it helps to maintain your lumbar lordosis, just a gentle curving in. So if your forward head posture is due to daily habits, then a good starting place is to learn a few basic mobility exercises for the head, neck, and thorax. So go ahead now. I want you to jut your chin forward. And then we're going to just guide it in gently with our two fingers. So forward and gently tucking it back in. Now, it's not so much ramming it back in as it is lengthening through the neck. So try a few more. Out, gently tucking, and back out. And then eventually you'll just release and tuck. And tuck. And it's all about lengthening through this area. Now, because the head sits on top of the shoulders, there's no point just working on the head and neck if your thorax is really stiff. So this is a great little mobilization we're going to do now. If you move to the edge of your chair, and you can also do this standing, but this is a great office desk workout. We're going to start with the arms bent at the elbows and just up beside you. And we're going to start with some gentle twists. 5 to 10 in a row. It's not maximal, just to create a little flexibility. Now from here we can deepen that and actually hold on to the chair and desk and push a little further around. Bring your head along with you and back the other way and back to this side and again. And again, do 5 to 10 of those, and then lace the fingers, pop them right on top of your head, and we're going to reach, I'm actually looking at the picture of myself so I can see what I'm doing here. We're going to reach towards the ceiling with the elbow. It's not so much a side bend, it's more of a movement through the rib cage. Remember, we're wanting to increase flexibility so that everything we do on top of the thorax also improves. So reach and reach and reach and reach. So 5 to 10 reps for each of those. And this is something you can do several times a day. Brilliant and easy exercise. And how long does it take to correct forward head posture due to our habits of daily living? Well, 8 to 12 weeks to notice improvements. More flexibility, less pain, but really a good 6-month commitment to see changes on the outside. Anything less than that, we're looking for a quick fix. And then there's more to consider. Things like age, how long we've been on the planet and been subjected to our daily habits is obviously going to affect the length of time. Past traumas we've had, we'll talk about that more. Lifestyles, what we eat, how many hours we sleep, how we take care of our emotional health, and then if there's any degeneration and wear in the joints. Those will all add time to the 8 to 12 weeks.
I don't like to mess around and pretend there isn't something for you to purchase at the end of the webinar. Of course there is. If I could help you completely transform your body in just 30 minutes, I'd never need to work again. So you'll get a ton of information and exercises in this free webinar today. That's important to me. And for those of you looking for a long-term solution, there are 25 spots available on the full course. Okay, let's jump straight back in.
The second cause of forward head posture is compensation due to poor postures lower down in the body. So in other words, the head sticking forward is doing that to compensate for what's going on down below. So it's important to know that there are actually 3 normal curves found in the spine. Remember, I prefer the term ideal to normal. So let's look at ideal here. So there should be a curve in at the neck, one out through the mid-back, and then another curve in at the lower back. So we've got a curve in at the neck and low back, and those are called a lordosis. And then we've got a curving out through the mid-back, and that's called a kyphosis. When the mid-back curve becomes exaggerated, that is known as a hyperkyphosis, or what I like to term slouchback posture. The other area lower down that can cause a forward head posture appearance is when the normal lumbar curve becomes exaggerated, or a hyperlordosis, or swayback posture. So let's look at one of the postures down below, slouchback posture. What are the signs? Well, first of all, as you can see with both of these clients of mine, it's an exaggerated curve through the thorax. Shouldn't quite be this round, and that juts the head forward. So we've got an exaggerated curve. It hurts to sit up straight. You're sitting up straight and you find you're just slumped again after a few minutes or even seconds. Round, tense shoulders, often really tight through the traps here. Headaches, stiff neck, brain fog, what we call muzzy-headed. Even sinus trouble and breathing difficulties. These are often the people with adult onset asthma. And yes, the forward head, they both have that. I want you to try this. I want you to slump down now. Really round your back, create that hyperkyphosis. Are you doing it? Okay. Now notice what happened to your head. It came forward, didn't it? Now I want you to try to breathe in. It's pretty hard, isn't it? Now let's reverse that. Sit up straight, gently bring the chin in again, and breathe in again. Much easier. Now, what about the other posture lower down, the sway back? What are the signs and symptoms of this type of posture? Well, certainly a prominent rib cage. So if we look at the black dotted circles on all three subjects here, you can see that they're kind of tilting forward instead of the green dotted oval or egg, which is the ideal position. So these people also generally have a weak core and a prominent stomach. Now, all three of these clients of mine are thin, but look how prominent their stomach looks. And that's because of this incorrect alignment through their rib cage, sticking it right out. They'll often have low back pain right in the area here where they sway, right in here, right up under those ribs. Tight groin muscles, round shoulders, really can see them in this middle case here. And obviously a forward head, really noticeable in all three people. So if your forward head posture is due to a posture problem lower down, slouch back or sway back, in other words, that forward head is compensating, what's the treatment that you need to be doing? Well, right back to manual again. So chiropractic, physio, osteopathy. This is just going to help break up the adhesions that you get better improvement, and it happens faster. Mirror image exercises. So think of these as the exact opposite to the abnormal posture position. So example, if your head is stuck forward, the mirror image, the exercise is to tuck it back, a chin tuck. And if your ribs stick out, you learn to tuck them in. That would be the mirror image of the incorrect posture. It's important to realize with a compensation, forward head posture that's compensating for lower down, this is a full body approach. It's not a quick fix. Let's take a look at a mirror image exercise for slouch back posture. So if we're slouched and flexed forward, full body extension is the mirror image of being stuck in a rounded position. And that helps to stretch out and lengthen the short, tight muscles on the front of the body. So in position 1, top left corner, you're going to support the head. And basically you create some nice arch through the back. Let's just draw that on now. And you can hold that position 60 seconds right up to 5 minutes. If you're able to go into the advanced position, top right corner, you can let go of the arms, rest the head right on the ball, and you're going to come back a little bit farther onto the ball to deepen the stretch. Again, 60 seconds up to 5 minutes. If that still feels easy, you can start bottom left corner in the more advanced position. So now you're starting with your head on the ball, opening the shoulders. You're going to get a nice stretch across the chest, holding that for 60 seconds or so before you go into the real advanced position. Now the arms are straight out again. The head and neck's actually coming back a little bit down the ball, and the whole body is opening into full extension. That one's pretty brilliant. Now let's take a look at the mirror image exercise I recommend for sway back posture. If you're watching this video, you're probably frustrated with your sway back posture appearance and low back pain. When normal lumbar curve becomes exaggerated, this is called a hyperlordosis or sway back posture. You're at greater risk of sway back posture if you've had multiple pregnancies, if you're overweight, sit for long periods incorrectly, or you've been a gymnast, ballerina, or dancer. My name is Dr. Paula Moore, and I'm the posture doctor. I'm going to help you fix your sway back. Most people try to sit up straight, and this makes their sway back worse. A better way to fix a sway back is to learn to tuck the ribs. Let's try. Sit with your feet flat on the floor. Now picture your rib cage as a giant egg. Grab a hold of the lower ribs and glide the egg back and forth. Tuck back and forth until you feel the movement. And now tuck the rib cage in so it realigns over the pelvis, which will lengthen and flatten your sway back appearance. Nice work. Do this a few times each day, right from your desk. Notice how you feel right now. Taller, leaner, confident. And the more often you do it, the more natural it will begin to feel. So how long does it take to correct forward head posture due to slouch back or sway back posture lower down in the body? Well, 6 months to a year minimum. And remember, that length of time can increase based on age, trauma, lifestyle, emotional health, and how much wear and degeneration is in the joints. Is it possible? Absolutely. Take a look at this client of mine. She's in her late 60s and had arthritis, wear in the joints. Look at that prominent stomach appearance with that real sway back posture. So that, again, remember, the rib cage is misaligned, kind of jutting forward. And look here, it's not like she had a flabby stomach. It was all about her positioning. That was just a brilliant correction. Is it perfect? No, but for someone in their late 60s, we were pretty impressed. The third cause of forward head posture is trauma. Childhood falls off a jungle gym, swings down a flight of stairs off their bike. Think of all the times we've whacked our heads as children. Broken legs, that's a big one, because they often lead to anatomically shorter leg lengths on one side, which can then cause the pelvis to tip down on that same side and result in a curvature in the lumbar region, which we call a scoliosis. History of violence, this has to be considered because 1 in 4 women and 1 in 7 men over the age of 18 in the United States has been a victim of severe physical violence in an intimate relationship. That's according to the National Domestic Violence Hotline. And thirdly, one of the most important is a road traffic accident. I see so many of these. If you've had one that's been over 20 miles an hour, it's significant. Even if you've forgotten about it or you walked away from it seemingly unscathed. Important to keep in mind. The reason trauma is important to consider with forward head posture is because trauma can change the ideal curve in the neck. Here we see a normal neck lordosis called a cervical lordosis. And with trauma, we can often end up with an alordosis. The A is simply Greek for without a curve. And here you can see a good example of a flattened neck curve and then a very severe flattened neck curve with quite a big amount of forward head posture. So traumas like car accident can take the curve out of the neck, making it straight like we just saw, but the other possible outcome following a car accident is a total reverse to the neck curve called a kyphosis, and this cannot be corrected through exercise alone. So again, on the left, we've got the normal curve in a nice C shape, and then on the right, we can see that in fact the neck completely kinks, and where it kinks, we've got a real worn disc. So what are the signs and symptoms of someone with forward head posture due to trauma? Well, morning stiffness is often a really good sign of past trauma because the stiffness results from having worn discs that gain height during the night, a little like a sponge. It takes them time during the day then to squeeze that water back out. So if you have morning stiffness that gets better during the day, this is a classic sign. Neck pain, headaches, decreased range of motion, really hard to check your blind spot in the car, tingling and numbness down the arms and right into the fingers, vertigo, tinnitus, ringing the ears, dizziness, forward head posture because that kink in the neck, and arthritis, as we can see on this left image, little bone spurs here on the tips, and really worn disc where the bones are closer together. And often these people present with a visible neck hump. So what kind of treatment is there for neck curves that have been affected from trauma? Well, absolutely, as I've said, with all the causes of forward head posture, manual adjustment and mobilization from a chiropractor, an osteo, or a physio, a hands-on approach, and in this case particularly to help break up sticky joint adhesions. Early on, general mobility exercises for the neck to increase that range of motion. So a lot of turns and bends and stretches, what I call generic neck exercises. If you're working with me, I'll often prescribe a home traction unit like this foam wedge that goes right under the neck to help reinforce and return that curve back to the neck. And in some cases, particularly those with a kink or reverse, you'll often need in-clinic traction. So how long will it take to correct forward head posture due to trauma? 6 months at least, up to 2 years plus. Here's an example of some in-clinic traction. It looks pretty extreme, but you're only started with maybe 30 to 60 seconds at a time. You're using your home traction every day, and then in clinic with quite a rigid schedule, often 3 to 4 times a week for 8 to 12 weeks, with the idea of taking a re-X-ray to measure the change and to guess how much longer it's going to take. It also depends on the degree of wear and degeneration in the joint. Some people might need to add time on to the 2-year mark if it's very severe. And of course, your lifestyle is a factor to length of time. So is it possible to regain a neck curve if it's been lost from trauma? Well, absolutely. Here's a perfect example. This woman came to see me. She's 25 years old. Daily headaches and forward head posture were her concerns. Immediately when I found out she'd had a car accident several years previously, we had an X-ray taken, and I think you could see a really obvious kink in her neck. Really obvious neck kyphosis. But because she had no arthritis yet, she was quite motivated to do her home traction. And I knew she could probably correct her forward head posture in about 6 months. 6 months later, re-X-rayed her, the one on the right. I think you can see how much progress she's made. Amazing results. She was thrilled. So what about prevention? How long will this correction last for her? Well, guess what? Once you've regained your ideal neck curve, it's there to last forever, unless you have another trauma. But even then, not all traumas cause flattened or reversed neck curves. And if your forward head posture is due to daily habits or slouch back or sway back posture, and you stop doing some kind of daily posture routine, the habits of daily living, well, they'll likely just result in poor posture again, won't they? So prevention is all about creating a daily posture habit for life.
Hello, everyone. Before we finish up today, let's recap everything we've learned and then do a little exercise together and talk about prevention. So first of all, we said forward head posture is when the head travels forward relative to our shoulders, which can lead to tight, aching muscles, headaches, worn neck joints and discs over time, reduced lung capacity, but also neurological and vascular complications as the arteries and nerves get stretched in this region. So we know there are 3 causes of forward head posture: our daily habits, compensation for slouch back or sway back posture, and trauma, which can flatten or even reverse the normal inward curve. We discussed treatment for forward head posture that should involve some kind of manual hands-on approach, changing our repetitive habits, improving our work ergonomics, doing specific mirror image exercises, and for some of you who have X-ray diagnosis, using home and in-clinic traction to correct flat or reverse neck curves. Now, to see lasting improvements in your forward head posture, you can expect it to take from 12 weeks up to 2 years or more, depending on the cause, and also your age, lifestyle, and nutrition. Now, once you've corrected or greatly improved your forward head posture, you just simply need to maintain it with some kind of daily posture size routine, so that the habit of good posture becomes neurologically wired into your brain. Now, here's a little exercise to leave you with. This helps to lubricate sticky neck joints and makes the tissues more pliable so that correcting your forward head posture is easier. Now, before you start, make sure your body is nice and loose. Shoulders are open, torso is long, and the knees are soft with a slight bend. You're going to let your neck roll side to side, a little bit like a billiards ball in a giant wooden bowl. And then once the curve gets quite large, you're going to give a push at either side. This is how it looks. Super easy. You'll notice that my torso stayed still. I didn't twist it when I was doing the pushes and it didn't collapse. I like to do about 15 or 20 repetitions, and you can do that about 5 to 6 times a day, especially if you work at a computer. So now is your chance to grab a spot on the full complete course. It's an in-depth training into cause, symptoms, ergonomics, and treatment for forward head posture. There are 42 lectures in this course. The full course is for any of you with visible forward head posture and those of you feeling self-conscious about your appearance. If you want to go beyond YouTube exercises and get a complete rehabilitation program, grab your spot right now. We've opened up just 25 enrollments because I like to work with motivated students, the ones who get results that last. If you don't get one of the 25 spots, you could still purchase at full price. So please jump in right now. These never last, and I don't want you to be disappointed. Thank you so much for spending the time with me today. I hope the information was super valuable, and I look forward to seeing some of you inside the course. Bye-bye for now.